Joining us live right now is our good friend, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe.
Hi, Ray. How you doing today?
I'm doing well. Nice. Looks like beautiful couple of days for us. Hey, what do you have for us today from the world of sports medicine?
Hey, could we put our prevention hats on? I mean, that's one of the nice things that we get to do with this weekly talk. This is the time of year, Ray, that there's the development of an injury that we see so much in our office, so much year-round, but particularly there's some elements of the summer now, the summer schedule, that cause this injury to be so common. One of the far and away most common injuries in a pediatric sports medicine clinic, and it's somewhat preventable. Ray, at this time of year, the high school calendar has changed a little bit with sports. And in the month of June, used to kind of be a month off. I remember those days. But in my 30 years now of practice, it's really become a month where a lot of high school kids start going to camps and start conditioning a lot, lifting weights. Even the younger kids are in the act. They go to places where they work out and lift weights to get stronger for the season. And invariably in the months of August, September, October, and really year-round, we see an injury to the low back, a stress fracture, the most common stress fracture area. You know that we talk a lot here that in my clinic, a lot of the injuries are overuse injuries, and we see upwards of 400, 500, 600 cases of stress fracture a year in the low back. And one of the reasons is the heavier weightlifting that kids start to do. So what happens? Who's at the highest risk? The highest risk are the younger kids. So the junior high kids or the freshmen that the body hasn't finished growing yet. We don't see this stress fracture very frequently in the seniors or the college kids. But this stress fracture is so common, and it has a name of its own. It's called spondylolysis. And athletes and athletic trainers call it spondy. And spondy is so common as kids get in the weight room, particularly with lifting, particularly a couple of lifts, overhead lifts like squat press. And kids that clearly don't have the core strength or the leg strength to be in a squat rack, they get into the squat machine and they start to begin to squat or deadlift or some of the Olympic lifts. And after a few weeks of lifting, they'll start having pain, sometimes very significant pain that bothers them all day, bothers them at night, localized pain, and a very common problem is a stress fracture in the low back. And it's hard to diagnose, although we see it so commonly in an office like ours that we diagnose it clinically a lot by looking and ruling out other causes, because it doesn't always show up on an X-ray if we catch this stress fracture or microfracture early. But it turns out that a lot of times kids will play with it or live with it for months, and by the time they come in, we will see it on even a plain film X-ray. If it continues to be painful, sometimes we have to go to advanced imaging like an MRI to diagnose it. But like so many overuse injuries, it's treated with rest. And so we have to, then in the months of September, October, the months they don't want to be out, they need to rest and rehabilitate and wear a brace in some cases to get better. And they're not happy about that. And so this is really preventable. So, we see it not only with weightlifting, particularly on the female side. We see it in girls who arch their back a lot, like gymnasts and cheerleaders and tennis players and volleyball players. And we see it on the guys' side equally, guys and girls. So on the prevention part, if you have junior high kids that want to be lifting, number one, they really shouldn't be in the weight room without supervision. They need to be in there with somebody who knows about the weights, knows what's good and what's not in the weight room. Supervision is necessary. Number two, no more than a half hour in the weight room for younger kids under the supervision. Number three, no more than 3 days a week and every other day. Give yourself at least a day in between to recover. Number four, if you're serious about weightlifting and you're a junior high, a younger kid, a growing kid, start with body weight exercises before you progress, and be very careful of overhead presses like squat and deadlift.
With us is Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. But it's a tough thing when you talk prevention with this, Joe, because these kids want to be mobile and try to strengthen themselves. I guess what you're saying is just be cautious here.
Be cautious. I mean, when they meet with their coaches, of course, a lot of times, whether it be their travel coach or their freshman JV coach, a lot of times the coach says, and they need it, with a sophomore kid, hey, you need to be stronger. With a freshman kid, when you come back next year, you need to have increased your strength. But there's so many better things to be doing, like working on, I know it sounds like a broken record, working on core strength first. Those kinds of, body weight core exercises, sit-ups, pull-ups, push-ups, working a lot on things around the core with medicine ball and other things that are not nearly as a problem for the back as going right into the squat machine. But, those are lifts that have been done for so long, back since we were in high school, and they're still done a lot. It's just pick the right population. That's not a problem for juniors and seniors. It can be a big problem for 7th graders and 8th graders.
All right, Joe. Good stuff this morning. Thanks a lot. Be safe this upcoming holiday weekend, and we'll talk to you next week.
Okay, Ray. Sounds good. Have a great week.
You too, my friend. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us live this morning.